Christmas. We have to give.
Hey guys, thank you for tuning in. Welcome back to Pink Ribbon Chat. For those of you who are new to my channel, I'm Addie, mother of 4, wife, career woman, and a stage 3 breast cancer survivor. So this month is African American History Month, and I thought we would discuss a little bit breast cancer in the African American community. So today I'm here at the University of Maryland School of Public Health to be interviewed on the subject of breast cancer and how it affects African American women in the community. So let's check it out, guys. You know, maybe not necessarily have to have surgery. I could have taken a different treatment path. There's a lot of different things that could have happened had I followed up with my doctor and kind of pushed them a little bit more. So I want to say, don't be afraid to push, because this is your life we're talking about. It's important.
Like, what are some of your thoughts on that?
So definitely, social media is a big platform. That is why I started Pink Ribbon Chat, because I knew that it's the quickest way to get to a mass amount of people is social media. But the other thing I want to say is that we have a lot of black women leading a lot of talk shows, right? And we as a community need to figure out how to connect with these black women or women of color that's heading up or leading or a part of a lot of these talk shows, so that we can communicate to them that it is important to continue this conversation. It's not okay for us to talk about breast cancer or cancer only in October and make a big have a big conversation about it. I'm happy that there's a month set aside for that, but they have a platform and they have an audience. And we need to figure out how we can talk to them about the need of the African American community from a healthcare perspective. And the conversation doesn't only need to be on breast cancer, but healthcare and the importance of healthcare, and even they can push and promote where information is available, because sometimes people just don't know, right? So they have an audience, they have people's attention, and most of the leading talk shows right now are headed up by African American women, and so we have to figure out how to talk to them and how they can talk to the community at large. I mean, I love them all. So we just figure out how to talk to them.
I think, okay, that's really great. I know we didn't get to ask yet about, so I'm going to ask, in overall, how do you think the experience of going through breast cancer, being diagnosed, treatment, whichever aspect of this whole experience has been different for younger African American women compared to older women, or maybe even just African American women compared to non-African American women, so Caucasian women? I think that angle we haven't touched on too much, so if you had any thoughts overall about that.
So
The differences.
I don't know too much about the differences, but I have actually read that we are the most affected and we die the most from breast cancer.
Yeah.
So we die the most more than any other ethnic group. And if you took African American women and Caucasian women, we don't get breast cancer the most, but we die the most. So that's the differences that I have identified through my experience and just learning. And so my question is, how can we close that gap, right? Do we need to go to colleges, and do we need to speak to the young women at the college level, right? Where do we start? Making sure that they are educated, because we're not at the highest rate of getting breast cancer, but we are at the highest rate of dying. So clearly there's a disparity. What is it, and how can we close that gap? So that's my mission.
From their angle, what should they keep in mind?
Well, it doesn't even have anything to do necessarily with African American women. This point that I want to make is follow up with your patients, whether black or whatever. Follow up with your patients is important, and their life is in your hands, right? So as far as African American women, this conversation is happening because we have identified disparities within the community, especially the African American community. So healthcare providers need to take the disparities into consideration, be it access, do they have facilities reachable? And so if they provide them with mammograms or something of that nature, and you would like them to follow up, provide them with the tools that is reachable. Can they get to the facilities to get the care that they need, right? So when we talk about disparities, we're talking about equal and unequal, right? Do they have, is there a financial impact in the community that is preventing African American women from getting tested and getting treatment? And then so the providers want to make sure that they are aware of that. If you're going to service a community, you need to make sure that you are, especially in the medical field, you have to be aware. If you need to do outreach, then do some outreach, but you have to be aware of where you are and how you can impact the community. What do they have access to? What do they need? Because then once you identify what their needs are, you can better service that community. You know what kind of plans to provide. Do they have insurance? Don't they have insurance? Do you need to have a program where if people don't have access to insurance or whatever the case may be, do you have a program within your facility that can still provide them with care? Or do you have the information readily available that you can then provide someone who might come in, who might have had a mammogram, but don't necessarily have the financial access or the means to get to where they need to go to get care? They need to be aware. Awareness is not just educating the community on cancer. Awareness is on both ends. You need to be aware of the community that you're serving and what you need to provide so that you can better serve them.
So when you talked about awareness of what they have or not have, you definitely went into it in terms of insurance, but you also mean in terms of what community resources are there or not.
Correct.
And being aware of those and being able to pass on.
Yeah, or if the medical facilities need to establish programs so that the community needs to know that these programs are available in these hospitals, doctor's office, whatever. They are responsible for making sure that they take care of the health care of the community. So if it means pressuring whoever the representative is within that community so that the funds and the grants can be provided so that they have programs to service the people. Everybody doesn't have insurance. If they don't, then you need to make sure that you have programs to service the community. And when I say community, I mean community at large. I mean the immigrant community. You have people who are not necessarily speaking the same language and the same lingo, and they're afraid because of whatever their status is to come in and to get service. So if you're serving the community, the people need to know that you have this information available to them, and that they are not going to be harassed, they are just going to be helped. So you have to do some outreach if you are the medical, if you're providing medical service within your community. You have to do some outreach to know what the community needs are, because if you don't know what the needs are, how can you better service them? Alright guys, so I hope you enjoyed my interview. I hope you learned something. I hope I was able to provide a little more insight and information on my experience and some of the things that I think can be done to assist in the disparity and help with the African American community and just women overall. Black women especially, we die at a higher rate. So hopefully, you got something from that interview that can help. If you like this channel and you like this information that was shared, please hit the subscribe button, hit the like button, and just remember, we share because we care. Take care, guys. Until next time. Thank you. Bye.
Thanks like we need it the most. We have to give thanks like we